Hi, I'm Lynn, one of the health educators here at Arthritis South Australia, and this is a short video about rheumatoid arthritis. Rheumatoid arthritis, often simply written as RA, is the second most common type of arthritis in Australia. In 2018, the Australian Institute of Health and Welfare estimated that almost 2% of the population, or approximately 458,000 Australians, were living with rheumatoid arthritis. The condition is more common in women than men, and the following slides give you a short introduction to rheumatoid arthritis and links for further information. Rheumatoid arthritis is an autoimmune condition. This means that it involves your immune system. Normally, your body's immune system fights off infections to keep you healthy. In an autoimmune disease, your own immune system starts attacking your own healthy tissues. Many people wonder what the signs or symptoms of rheumatoid arthritis are. It is important to remember that rheumatoid arthritis affects everyone differently, and there are a wide range of symptoms people may experience. The next few slides look at some of the more common experiences. And while the symptoms mentioned are common for many people, not everyone will experience all of these symptoms all of the time or to the same extent. Common signs of rheumatoid arthritis include an effect on your joints. This is often seen as swollen and painful joints that can be very tender to touch. Stiffness in the joints. This may result in difficulty moving or bending your joints. Many people with rheumatoid arthritis notice that this is particularly pronounced in the mornings. The pattern of joint pain and stiffness is often symmetrical or bilateral, meaning that people experience symptoms on both sides of the body at the same time. For example, you may have similar symptoms in both hands at the same time. These symptoms can cause difficulty with everyday activities, such as getting ready in the morning, driving a car, or walking. Other symptoms may include tiredness and lack of energy, which is also known as fatigue, a poor appetite, weight loss, a high temperature or a fever, sweating, dry eyes, which is as a result of inflammation, and chest pain, which is also a result of inflammation. Rheumatoid arthritis can affect any joint in the body. Smaller joints, such as the joints of the hand or the feet, are often affected. As mentioned earlier, the pattern is often symmetrical. So, for example, both feet at the same time. Remember that everyone with rheumatoid arthritis is different, and while the symptoms mentioned are common, the way you experience them will be unique to you. It is not known exactly what causes rheumatoid arthritis, or why you may develop the condition. It is known that the condition runs in some families, and it is thought that some factors, such as environmental factors or smoking, may also act as a trigger. However, not everyone with rheumatoid arthritis has a family history or can identify a trigger for development of the condition. Anyone can get rheumatoid arthritis, but it is more common in women than men. While people often think of arthritis as something you only get when you get older, you can be diagnosed with rheumatoid arthritis at any time in your adult life. If you think you may have rheumatoid arthritis, firstly, talk to your GP. Talk to your GP about your symptoms and how these are affecting you in managing your usual daily tasks, such as those at work or at home. It may take a number of visits to the GP to identify what is happening. As part of these investigations, your GP may order some tests, such as x-rays or blood tests for inflammation. For more information about blood tests, view the fact sheet Blood Tests and Arthritis on our website. If your GP thinks you may have rheumatoid arthritis, they will refer you to a rheumatologist. Our next slide looks at the role of a rheumatologist. A rheumatologist is a specialist doctor. Rheumatologists work with people who have arthritis, autoimmune diseases, and other musculoskeletal conditions. The rheumatologist is the medical professional who can make a formal diagnosis of rheumatoid arthritis. It can take time to make a formal diagnosis. You may need to make a number of visits to the rheumatologist and have additional tests and examinations before a formal diagnosis can be made. Many people ask if there is a cure. No, at present there is no cure for rheumatoid arthritis. However, treatment and management has changed much in the last 20 years. The aim is to minimise the impact of the disease on your body, your joints and your life. In the next slides, we look at some of the goals of rheumatoid arthritis management. The goals of treatment can include managing inflammation, relieving symptoms such as pain, fatigue or stiffness, improving physical functioning and your overall well-being, and reducing long-term complications. Depending on your individual circumstances, the priority of these goals will be different. The healthcare team can support you with different approaches to help achieve your goals. In the next slides, we look at a major component of rheumatoid arthritis management, medications. There are a number of different medicines used in the treatment of rheumatoid arthritis. Access to some of these medications is restricted by the Australian Government. Your rheumatologist will play a central role in prescribing your medications. Fact sheets providing general information on medications are available on the Arthritis South Australia website. Some drugs are mainly used to relieve symptoms, for example, non-steroidal anti-inflammatory drugs, often referred to as NSAIDs, which may be prescribed by your GP or specialist. Other drugs slow the course of the disease, for example, a group of medicines called disease-modifying anti-rheumatic drugs, often referred to as DMARDs. There are a number of different types or classes of these medications, and they will be prescribed to you by the rheumatologist. Fact sheets on specific medications are available on the Australian Rheumatology Association website, www.rheumatology.org.au. Many people wonder what they can do. Talk to your medical team about current and ongoing medical management. Understanding the role of your medications and ways to manage side effects and ongoing medical management such as blood tests will help you manage your condition. Learn about your rheumatoid arthritis. Knowing about your condition will help you in managing both your symptoms and the demands of daily life. There is support available to help you learn ways to manage symptoms such as pain and fatigue. A healthy lifestyle can help you live well with your condition. It might include quitting smoking, being physically active, healthy eating, or emotional support. It's different for everyone and it will change over time, but there is much support available. The medical and allied healthcare teams can support you with many aspects of managing rheumatoid arthritis. For more information on the role of different healthcare professionals, view the Who's Who in Your Healthcare Team presentations on the Arthritis South Australia website. To find out more about rheumatoid arthritis, contact Arthritis South Australia. Our information line is open 10 till 3, Monday to Friday, on 1800 011 041. Or email us on info@arthritissa.org.au. For copies of booklets and fact sheets such as exercise in rheumatoid arthritis, have a look at our website www.arthritissa.org.au or visit the new website MyRA www.myra.org.au. Thank you.